Alright, today is my life with MS video. Too freaking hot out. It's in the 90s again this week, so not gonna go do any wandering around out in the yard. So I figured I'd get through some of the old crap that's been emailed to me or regular mailed or just messaged to me or sent to me or put on websites or whatever, and MS related sites. Figure I'll go through some of those, clean up some more of the files in my computer. I noticed I got a ton of stuff just piling up that's I click on and those websites don't even appear anymore because I've had this stuff for like, God, I don't know, 2014 is when I got diagnosed, so a lot of this stuff could relate back to probably around 2020, 2018. So some of those websites are not there anymore, or they never did anything that they said they were going to do. Update on me at the moment. I'm done. I'm so sick and tired of the overall body pain. I just can't beat it. The heat's not helping. It's making it worse. Doing the weed whacking, yard work in the 85 to 95 degree range. Not smart when you're heat intolerant with your neurological condition. So that wasn't too smart, but either way it wouldn't really mattered. It's just this overall body pain's been back since January. And it seems way worse than it did just because I am not used to it anymore, because I had a nice 6-month, 9-month eased up break. Not a complete break from it, but way less pain from it. So that sucks. And I'm so done. It's like everything we do, anywhere we stop, anywhere we go, I can't enjoy even talking to people. It's like I fell down in the probably the last 2 to 3 weeks, just from standing up. I fell down, collapsed. Oh, a good 8-10 times. Or just at a friend's house a couple days ago, and I stood up off their couch and almost ended up going down on their coffee table. It's just between these stupid leg wraps that make I have to wrap them on the foot part and the leg part, so when you're walking and you got shoes on or whatever, you got the damn wraps are messing with the feeling of my feet. With being asleep from the ribs to my toes, you got that weird numbness feeling. And so what I'm feeling when I walk and move, I don't get to feel the ground. I don't get to feel the pressure on the floor. I get the pain in my heels and stuff like that, and the pains throughout all my little cushions on my feet and stuff. I get that pain, but I don't mentally feel the pressure like it's touching down on the ground. So my feet are always feeling like I'm a little bit off the ground, so I'm never secure in my footing. And it just really fucks with the head. With having vertigo, lightheadedness, dizziness, gait issues, and all that stuff with the walking issues, and all those things combined with the wraps and the numbness, I very rarely feel like I'm actually walking on the ground. I'm guessing this is another Senator Ron Johnson. I want your vote. And it's a stupid recorded message from the senators. It's that time of the year, wonderful political time of the year. But he's the 5th telemarketer that's called today. And it's like, seriously, you can just stop calling. And it's I'm sure his automated thing's going to go here. Yeah. You can tell it's not a human being talking, but it's like a pre-recorded message that he has to stick on the website. But yeah, or on the phone message. It's just really annoying. It makes you want to call the jackass and tell him to piss off. It's guys aren't doing nothing in our state anyways, and there's no new people lined up to take their spot that's worth a shit, so I don't want to hear them. It's like, come on, Ron, just go away. I mean, seriously, don't, I mean, God, just shut up. Seriously? Another one? Another Senator Ron Johnson. I muted the ringer somehow, which I don't know how I did that. I've never done that before. Yeah, hopefully that'll stop it. It's not going to start talking again. But yeah, 2 back-to-back calls from Senator Ron Johnson. Yay. What was I talking about now? Yeah, just the overall body pains and not being able to feel yourself physically walking on the ground. So every step you take, when you're out and about, when you're walking around, if you're going up and down stairs, everything's just wonky feeling, and just it's irritating, because all I want to do is walk like a normal freaking person, like I used to. So I used to love going for hikes and stuff like that. I can't even imagine going to a waterfall right now and going for a hike, going out to the Killamrain, out into the woods, going and playing with the dogs and stuff. It's like, it just sucks. I don't know how I can get beyond this. If anybody that has the overall bruised body pain, beaten feeling, and has any ideas to do something for it, I'd appreciate your input. But medicine-wise, there's nothing worth a shit. There are some DMTs that supposedly help with it, so I was hoping that I'd go on a new DMT that used it, but yeah, I'm just gonna, it's really a bummer. Just I can't enjoy going anywhere anymore. It's just so frustrating. We did the fireworks show the other night. Took my walker up in the dark. I felt like I was stepping in holes constantly in the yard, but they're not there during the day. So I don't know, I was struggling walking back to the house. Kept feeling like I was going to fall in a hole or something. And the vertigo part just had me feeling like I was running downhill the whole time. And it's just a nice little, slight little incline in the yard. Not much, but definitely messes with your brain. Other than that, we've been, just trying to get some yard work done, trying to get some things rearranged around here, and just helping me and the wife both carrying stuff the other day together. And it's just, I used to be a mover, for Christ's sakes. I ran Mayflower Moving. I worked with United Van Lines and all the other companies, and just can't pick up shit nowadays, and my body's so weak that it just can't lift stuff anymore. And it's like, it's sad. It's like I can't even consider moving a couch. My hands, between how my hands don't work and then not being able to physically maneuver things and lift things like I used to, because of the pains and the numbness and everything. And with forearms to fingertips are the other part of my body that's asleep, so it's like when you go and pick something up, you don't really feel that you're holding the item right, and I'm constantly slipping and dropping stuff, so that sucks, because so much of my life requires me to do this type of things. I got a lot of shit I gotta move around right now. I got probably 100 crates of comics that I want to get rearranged and removed and gone through, and it's just not getting there. It's lucky if I get through a crate a year. It's sad. Yeah, it's messed up. Other than that, I don't think I have a appointment till my cardiology appointment in September, but I decided a couple days ago, and then today I mentally definitely 100% decided to give him a call. I'm going to do it after I'm done with this video, but I got to get a hold of my foot doctor. I'm going to have her inject my heels again, because with the big con coming up in September, August, we'll probably try and get to a couple things. see what happens. There's a thing this Sunday that I wouldn't mind running to, but I don't know. It's just the way I felt and the way the heat's been. I don't even give a shit. You could have 10-cent comic deal, and I probably wouldn't even come to it. Yeah, I would. But yeah. Other than that, I don't think I have. I really can't talk about any medications or anything because I'm not on anything anymore because my doctor doesn't want me on anything. I'm on all the stupid heart medications that the dumbass doctor that misdiagnosed me put me on, and nobody's taken me off of. That's why I'm looking forward to the cardiologist in September. I'm hoping we can drop a couple more of these. He had me cut the one in half, but that's all we did, and that was 2 years ago. See what happens with that. I'm also gonna, if I go in for the foot injections, I'm gonna ask her if she's the one that has to give me a referral for neurological nerve damage testing. I'd like to know for sure with certain issues that I have that I'm pretty positive are nerve damage related, and I'm hoping I could get on some type of program to help with that, and maybe that will help with the numbness a little and the overall body pain and stuff. See what happens. But yeah, if I think of anything else I wanted to talk about, I'll bring it up. I just burnt out from the heat and the pain and everything. Just pretty much done with it. It's like if I didn't have my wife, I would run off, go live in a cave somewhere, and just curl up and die. I just don't even give a shit anymore. But since my wife's still here, as long as she's around, I'll be around. But yeah, something happens to her or us, I have no purpose in life anymore, and I ain't gonna sit there and suffer for no reason. So yeah, I have no purpose in life, no life to look forward to. It's a 24/7 caretaker. Now we're at the point where I can't even leave unless someone's here to cover for me. So it's like, what do you do? And you have no life. I can never go on a vacation, but yet all my other siblings, they'll sit there and take multiple trips throughout the year. Go on vacations and do all these things. I gotta struggle to try and get my wife just back home to her family. Hopefully this year again. And last year was the first time in probably 15 years that we were able to get her back. And so I'd love to go with her, but I can't even do a 4-hour trip in a car. I don't know how the hell I'm gonna do a 28-hour trip, whether it be by car or rail or whatever. Yeah, hell, I'd love to be able to just get in my car and go see a friend. So I can't do that. Unless I got someone to cover for me. So life at the moment is over. It's at a standstill. There's not much enjoyment to it, other than my cat, my wife, my comics, my games, my art, things I enjoy doing, but I don't make money off them. I'll never make money off them. I don't make money off being a 24/7 caretaker. So it's like all I'm doing is hemorrhaging funds to keep other people alive and hating myself being alive because it's just so freaking painful. And it's just, what do you do? I can put out 1 million videos. I can put out 1 million ideas. I can put 1 million books for sale on websites and stuff. Still can't scrounge up enough to survive it decently. And society just keeps increasing the prices on everything. So yeah, now we're at that stretch where all our shit's starting to break. All our electronics are taking a crap on us and are slowly trying to replace certain items. See how it goes. It's like, yeah. The world. I want to go back to those days where you're just hanging out with friends, out at the beach, partying, having a good time, no care in the world, being little dickheads. It's like, stay up all night, party all day. It was so much fun. Now all you do is think about death. Yeah. But yeah, I could shut up now. I'm just rattling on for no reason. But let's go over some of the crap that I got in my files piled up. I mentioned it probably a couple of years ago because it was 2022 that they put it out, that the heart medication digoxin, and they put that it helps with remyelination in early mouse studies. But I haven't heard nothing else from it, so I don't think it went anywhere. I don't think it was going to work out human related or something, because if they were having luck with mice and we never heard anything else more from it. Take a swig if you got it. I had really bad dry mouth the past 2 weeks with this overly hot weather, but they were planning on using it possibly in a future DMT for remyelination potential in multiple sclerosis. But yeah, I have not heard anything else about the results of the overall testing. If they ever went to a human trial or anything like that, because that would have been 2022, 2 years ago. It could be another year before we hear. Usually within 3 years you hear whether or not the results were positive enough to put it towards human trials and stuff like that. But we might hear something more of it in the future, but I have not heard nothing about it since that original post. So just have to see what happens. A lot of people are starting, and this time it seems like summertime is the time when a lot of people get diagnosed with MS for the first time. You figure usually June, July, the heat's picking up and it can set certain things off, give you some relapses and stuff. You might have had an issue and then have no issues for 3, 4, 5 years. Then all of a sudden you're out in the sun partying with some friends, and all of a sudden your body just gives up on you, or you start having certain issues and stuff, and it's all related to heat sensitivity and stuff. But it's a good thing to get your cooling devices. They got the cooling neck wraps, hats, vests, and little wrist wraps, towels, all kinds of different things. Or you can do it yourself too. Just wet a towel down, throw it in the freezer, and you got a nice frozen towel that you can put on you. Yeah, you're gonna get wet from it, but hell, it's summertime. And nothing wrong with getting a water balloon fight or something. Just make sure they're using nice ice cold water. But with starting new medications, you can always have nausea issues from the medications. Some natural ways. We've talked about this many times, but it's always good to remind people just in case, because nausea sucks and you don't want to have to be trying to think of a way to fix it and not have the items around your house. And a lot of these are things that you can use for your normal cooking and still have around the house in case you have to. Ginger is always a popular one. A daily dose of ginger may be an effective alternative to anti-nausea medications in a variety of situations, including during pregnancy and after chemotherapy. I have a bag of those little ginger candy chews. I keep those around in case I have to get some ginger in me. I'll sit there, and when I buy a chunk of ginger root for a recipe or for something, it's useless to leave it in your fridge because you're not going to use it all unless you do use a ton of ginger. But if you're like me, you're going to use it for a recipe, and then it's going to sit in the fridge, and next time you go to grab it, it's going to be all mold. So what I do is I'll use it for whatever recipes I need within a week's time, and then I'll sit there and take the rest of it and dice it into little coin-sized like the size of a quarter, just coin size little circles that I'll throw in the freezer in a Ziploc bag and throw them in the freezer. Then you can always throw one in a cup of coffee or something if you want to use your ginger that way or something. And it stays good in the freezer. You don't have to worry about it. Smelling peppermint oil on the onset of nausea may help reduce your symptoms. You can try acupuncture, acupressure. Someone that is well knowledgeable in those fields may know of ways to hit certain spots that can help with the nausea-related issues, stomach-related issues and stuff like that. Citrusy smells, whether from a freshly cut lemon or from store-bought essential oils, may help reduce pregnancy-related nausea. Specific controlled breathing techniques are a free and effective home remedy. You can just sit there and do your breathing techniques and see if that helps. Certain spices may successfully reduce the frequency or severity of nausea. However, large doses may be required and more studies are needed to confirm these effects. So if you're going to need larger doses, you might want to try them in pill form. I know they talk fennel powder, cinnamon, and cumin are three popular ones. Cinnamon and cumin I think I've seen in pill form, but I don't know about fennel powder. I've never used that stuff. Relaxing your muscles, whether through massage or PMR techniques, may help relieve nausea. B6 for pregnant people. And obviously things like changing your diet and staying active, eating small frequent meals, and opting for foods that are rich in protein and easy to digest may help ease it. Stuff that's not going to irritate the gut. Play around with your stomach. Drink plenty of water, of course. But those are some simple techniques. I say go with the ginger, and anything else you can try if the ginger doesn't work, but ginger is usually a pretty good proponent to stop the nausea problems. They have some correlations between thyroid disease and MS. I don't agree with it. I think they're separate diseases. They say the thyroid plays a critical role in controlling metabolism. That is the way the body turns food into energy. Like MS, thyroid diseases can have an autoimmune component. Autoimmune disorders are conditions in which the immune system attacks its own body and healthy cells. One autoimmune-related thyroid disease connected to MS is Hashimoto's disease. This condition causes hypothyroidism, an underactive thyroid, or too little thyroid hormone. Graves' disease, another autoimmune-related disease, causes hyperthyroidism, an overactive thyroid, or too much thyroid hormone, whereas the other one was too little with Hashimoto's disease. The signs and symptoms of an underactive thyroid may include fatigue or sluggishness, muscle aches, tenderness, stiffness or weakness, joint pain or stiffness, more sensitivity to cold, constipation, pale dry skin, puffy face, brittle nails, hair loss, swelling of the tongue, weight gain, prolonged menstrual bleeding, depression, trouble concentrating, and memory lapses. A lot of issues that I have, and a lot of issues that are related to MS. Some signs and symptoms of an overactive thyroid include anxiety or irritability, tremor of the hands or fingers, fatigue, heat sensitivity, heart palpitations, warm, moist skin and increased sweating, weight loss, bulging eyes, irregular menstrual cycles, reduced libido and erectile dysfunction, frequent bowel movements, thick darkened skin on the tops of the feet or shins, and sleep problems. Some issues that I also have, and some things that are definitely MS related that they share with MS. But yeah, you can go, I say, go to your team, go to your medical team. I'm not a doctor. Don't listen to me for my ideas and stuff. I just tell you how I feel and what I go through. None of my shit's gonna work for you, more than likely. It's, MS is a snowflake disease, so we're all different. But there goes my glasses. We sat there, and you can sit there and go get tested. I went and got tested. My thyroid was fine. I was hoping that it wasn't, just because a lot of the issues that are related to it. I thought maybe I could sit there and get on something for the thyroid and maybe it would help with some of my problems. But no luck with that. I just can't stop drinking while I'm talking because my mouth is just drying up. My mouth and throat just keeps drying up instantly. They're talking about neck stiffness being a symptom of MS. I have issues with it on and off, where it can get very painful. You can't turn certain ways and stuff. A lot of times, though, it's from when I'm sitting there reading for a long time. See, several MS team members have shared their experiences with neck stiffness. Does anybody else during their bad MS flares get stiff in the neck? Asked one member. Yes, another replied. My neck gets stiff often. So like I said, it's snowflake disease, so we all can share problems that we've had with it, I'm sure, at one point or another. But one says, what felt like a stiff neck, despite maintaining a full range of motion in her neck, she added, when I turn my head to the right, I have a pain from what feels like the back of my ear to the back of my head. Lifting my head off the pillow feels like an absolute worst. Yeah, I get that right through here. But I don't consider it neck stiffness. I consider it more of a shooting radiating pain that's coming up from the side of my head. I don't feel like it's coming from the spine, from the neck area. I had a stiff, painful neck for 2 weeks. First, I thought I must have been lying in bed wrong, but it hasn't been getting better. I wondered if it is MS related and if anyone else is having this. But neck pain, back pain, sciatica stuff, all related to MS issues. A lot of us can have it. Certain sensations, such as the Lhermitte sign, where when I bend my neck forward, I'm getting electrocuted at the moment, and it's going from right here all the way down to my toes, and it's like zzz, like a little electrified sensation going through. It's not too bad today. It can go from the little electrified sensation to a hard, intense sensation of being electrocuted to orgasmic sensation. I call it a spinal orgasm. It's like, it just sometimes doesn't feel that bad. It feels kind of funky and stuff, but yeah, those can all be related to. So watch those. Treating it, you're going to want to talk to your doctor and probably get some type of anti-inflammatory medications such as duloxetine, tramadol, lidocaine patches, and there's other types of muscle relaxants and stuff might help. Physical therapy, exercise, just work with your doctors, your team. Water aerobics are great for dealing with the messed up muscles. That way you're not overworking them by adding weights to them and stuff like that. Using that water therapy, it's just so much easier on the body overall. That's probably the best way to go. Let's look at the effects of multiple sclerosis on our body. We got the brain, where we can have personality and mood changes, dizziness, confusion, memory problems, difficulty concentrating. Our ears can have hearing loss. Our eyes can have vision changes or loss. And there's so many extra things you could add into these different sections easily, especially with the eyes. I mean, they should have about 15 more things in there, between seeing things, the world bouncing and moving and tilting, vertigo, all that different stuff. But yeah, I'm just giving you what they got down, but there are tons more that you can add to these that are all MS related. Lungs, difficulty breathing. Some of us get the really shitty side of MS and make it long term, might end up in a hospital, stuck to breathing and feeding tubes. That ain't happening to me. I signed the waiver that it gets to that point, just put a bullet in my head. Just pull the plug, do whatever. I don't care, but I ain't gonna sit there and try and swallow with these big old tubes sticking down my throat. Where was I here? Mouth, speech, and swallowing problems. You get that erratic speech. You get cognitive issues. Swallowing problems can be annoying. I have moments where all of a sudden I forget how to breathe. And I'll be in the middle of breathing in or out, and I'll forget how to do the opposite. Stuff like that. Heart, you got increased risk of cardiovascular disease. Arms and muscles, you got pain, numbness, tingling, impaired hand-eye coordination. Our veins, treatment can cause immune suppression. Our reproductive system, increased risk of infertility and sexual dysfunction. Our bones, increased risk of osteoporosis. Our leg muscles, muscle weakness, impaired balance. Bladder, your weakened bladder and bowel control, diarrhea, constipation. It's just, there's so many things. Primary symptoms of MS are those that occur due to damage to the myelin sheath and the nerves within. Doctors may treat these symptoms with medications to prevent MS attacks and slow demyelination. This can include vision loss, weakness, sensory changes, trouble concentrating, all kinds of things like that and more. Secondary symptoms of MS are complications that arise due to the direct effects of MS. Examples include urinary tract infections that result from weak bladder muscles and a loss of muscle tone that result from an inability to walk. Doctors may treat secondary symptoms with medication and other therapies. I call BS because I'm secondary progressive. Now they don't want to treat me with any medications. Just, I don't understand what's going on yet. I'm still confused about that. Our nervous system can also have symptoms that include dizziness, vertigo, confusion, memory problems, mood or personality changes. Lemmy hanging out with us. And he's got his nails so long that they're stuck to my shirt. He just constantly gets this one hooked right on my shirt and keeps ripping little holes in there. But let's bring you up a little bit so you can see the cat better. Vision and hearing loss, you got double vision, diplopia, blurriness or dimness, pain, loss of color vision, shaking of the eyes, nystagmus. And it's kind of funny because, I don't know, you can't see it probably, but my eyes, I could always do that thing since I was a little kid where I can make them shake back and forth really quick. I don't know if that's something that relates itself to MS or what, but with speaking, swallowing, and breathing, you gotta worry about dealing with slurring your words, difficulty articulating, disrupted speech pattern, trouble with volume control, stuttering, changes in pitch, nasally voice, hoarseness, or breathiness. I was always told that I was mumbling my whole life. Slurred speech and stuff like that was always a problem with me, and always criticized for it, but no one ever helped try and figure out why you had the issues. Muscle weakness and balance issues can include things like pain, tingling, numbness, trouble with hand-eye coordination, muscle weakness, balance issues, walking difficulties, gait problems, all that. Skeletal system can have issues that are slowed through physical activity, diet and supplements. Osteoporosis can be slowed if you get into by doing physical activity, diet, and supplement stuff is what I meant to say on that one. Vitamin D supplements are a big thing with MS, but you also got to look at your numbers. I get my vitamin D tested in my blood test, and that way I can sit there and keep an eye on everything and change my, because I'll do 50,000 units usually once a month, and then I do 5,000 units of vitamin D a day. But then when I see my numbers, if they are higher, I'll back off a little bit during summertime and stuff, because you're getting out in the sunlight. All it takes is 15 minutes of sunlight and you're getting your vitamin D, as long as you got some available flesh that's open for the sun to penetrate. Bladder and bowel functions can include constipation, diarrhea, loss of bowel control, difficulty holding in urine, incontinence, difficulty urination when you want to, retention, voluntary or involuntary release of small amounts of urine, spasticity. I got all three issues right now, and it's really pissing me off because my medication I ended up doubling for the bladder issues, thinking that it would hold up longer, but I'm sitting there all night long, getting up every half hour to 45 minutes to an hour. And it's like 6-8 times a night. I'll be getting up to go to the bathroom, and you're down in the basement, so you gotta go up those stairs, and with the all over body pains and struggling walking and having to crawl up the stairs, it's like, it's no fun at all. Every time you have to get up, it's like, as soon as you fall asleep, it's time to get back up, go piss again, come back down. You're so freaking tired from going up and down and trying to get it out of your system. But it's like, when I'm sleeping at night, I'm guessing it's because I'm laying down, your bladder's just relocating the fluids around too much. If you lay on your left side of your body, your bladder will dump into the pocket more and cause you to go to the bathroom more. But yeah, I'm guessing laying down is affecting a lot of that, because during the day I don't have to go that much. I can go every couple hours or every 3 hours, unless I'm drinking a lot. But for some reason at night, for the past couple months, it's been like every half hour, 45. It's more like every half hour, 45 minutes I'm up, and it's just, I'm done with it. I'm burnt out, and then I gotta get up with the cat 2 hours after I go to bed, and then go back to bed and try and get another 4 hours sleep, and then you're peeing every half hour. Yeah, it's just not fun. But it's just not working out well. MS can cause an increased risk of infertility in people with MS. Circulatory system can include issues like coronary artery disease, heart attack, myocardial infarction, heart failure, and atrial fibrillation. I was born with atrial AFib stuff. I had a flapper that had problems when I was a kid. Couldn't go on certain things when I went to the dentist and stuff like that, but it apparently healed itself. But yeah, those are just things to keep an eye on. Things you may or may not deal with at the moment. You might deal with them in the future. So you might as well prepare yourself and get some knowledge on the different things and just learn about them. Yeah, I'll talk about one more yet. What is an MS Zinger? MS Zingers refer to neuropathic sensations such as pain or pins and needles caused by multiple sclerosis related damage. Treatment can involve medical treatment and avoiding triggers. Dysesthesia. Let's see. Let's see. Depending on the extent of the nerve damage, patients may report numbness or the lack of sensation, or they may perceive the sensory symptoms in different ways. They don't have a good. This one's not laid out decent and stuff, but I don't want to hear the different people, like people on the MS Facebook page that say they experience zingers or painful sensations in areas such as their neck, head, and legs. Some even say it feels like they're being shocked by electricity. It's like I can feel like I'm being shocked, stabbed, electrified, like someone's taking little slits of flesh and just peeling them off me, like 1-inch wide pieces of flesh. It just, you can just be sitting there and all of a sudden it feels like someone shoves a 5-inch blade into your body, just getting stabbed, and any movement you make or anything like that. But yeah, it's like, just let your doctor know there are options that you can use, like amitriptyline, gabapentin, nortriptyline, phenytoin, carbamazepine, and pregabalin. I feel like there's a couple more nowadays out there. I don't know how old this story is, but talk with your doctor, ask them. And I will get back with more stuff soon. So keep following Under the Cult of MS. Rate, review, subscribe, tell a friend, give us our likes. Help us out, and we will get back with more of these videos. I'm trying to get at least one a week out for MS, or one every 2 weeks, so just keep an eye out for them. We'll get back to you again soon. Thanks. Bye.